All right, so we'll have the core training recording for anybody who missed this meeting, especially on the call center. I'll have that link available so that as we go over the core plans that were available. And so Erica's created this wonderful benefit booklet for the employees. And let's see, I'm going to pull up the first, like she's mentioned already, Aetna is the medical plans. Their open enrollment will go through the end of the month. And the plan changes are effective on April the 1st, just like with Colonial, and full-time employees that are working 30 hours a week are eligible and have fulfilled their waiting period, which I think the waiting period is first of the month following 30 days. Is that what it is, Erica?
Yeah.
Yeah, that's what I thought. Okay, and just like normal, it's open enrollment period is when people can enroll. Outside of open enrollment period, you have to have your qualifying event, life event. All righty, so here we go. The first Aetna HMO plan is a traditional HMO plan, and I think you mentioned that there was some changes. So I'll let you, Erica, explain the 3 Aetna medical plans so that you can explain what changes are different this year.
Okay. Well, basically on the snapshot here, this is the traditional HMO plan. So it's a full network HMO. It doesn't have a deductible. The primary care office visit is $50, and then specialist is $60 copay. They did, let me see what I have. I don't know how to get back into to see what they changed, but I know that the copay did go up. I think it was $30 for PCP, and it was $40 for a specialist. But when we're at the meetings, and I can always send you, like later on, Andrea, the previous benefits so that you guys can see that. I don't have it handy right in front of me.
Okay.
Is that going to be a problem?
No, that's not going to be a problem. It sounds like there's just some small changes that they must have configured.
Yeah.
Yeah.
So basically, there's an increase in the copays. The maximum out-of-pocket limit is the same. It's $4,000 for an individual, $8,000 for a family. The inpatient hospital is a $1,000 copay, which went up from, I believe, $750 to now $1,000. The outpatient surgery is a $200 copay. I think that went up slightly. Emergency room, I think, stayed the same. And then the RX on the, I think on the non-formulary went up, just slightly. So that's a $15 for generic brand name. It's $35, and non-formulary is $50. This is a really straightforward plan. So, basically, I don't know if they want to use your GAP plan for that $1,000 copay. That's the kind of stuff that you most likely will be feeling. A lot of the employees are not enrolled on this plan because it is the most expensive of the 2 HMOs for them to enroll on. The employer contributes the least amount of money.
Okay, and so then the next plan is the other HMO, the HRA, the Health Reimbursement Account. Now,
yeah,
on this one,
this is a little tricky.
This one, what?
This one's a little tricky.
Yeah, because I was going to have questions on that. It's the first time I've seen an employee fund, so I need you to explain the employee fund and everything.
Yeah. So with this one, okay, this one is an HMO plan as well, but this one does have a network that's a little bit more scaled down, so it's not as broad as the first HMO that we just went over. But in most instances, most doctors have been in the network. We haven't had any issues with them not being in this HRA plan. With that being said, there's an employee fund that is linked to this, and it is funded by Aetna, not the employer. And what happens is it's built into the plan. They get $500 of this fund per individual, $1,000 for a family, and they can use that fund to pay out towards their deductible, which is $1,000 for an individual, $2,000 for a family. So essentially, their annual deductible is only $500 for an individual and $1,000 for a family after the fund comes into play.
Now,
Go ahead.
Do they have to have a health reimbursement account set up?
No, this is all built in, baked into the plan. This doesn't have,
Okay.
they don't, this fund is a part of this Aetna plan, so they don't have to do anything on their part. They automatically get this fund when they enroll in the plan. And there's no additional paperwork. There's nothing.
Wow. Okay.
Yeah. So again, the deductibles waived for the office visits on this plan. You got your out-of-pocket maximum. Those, I know the office visit and the out-of-pocket max went up slightly. The co-insurance is the same. It's still at 20% and 10%. And I think the ER went up slightly on this plan too. Oh, maybe not. Looks like it's still at 100. So, and then the drug card, I think the non-formulary went up slightly. But again, they're very familiar with this plan. They've been on this plan since 2013, since we rolled out Aetna for them and switched them into the large group market, because they were small when I was talking about them earlier. When they were 70, they had a small group policy. So they're very familiar. Most of them are with how this works. So this is not some new plan. They just, again, it goes in one ear, out the other, and they need to, you know, have a little update every year on how certain things work. So
okay,
that's pretty much that one in a nutshell.
Is this the plan that the majority of the employees are on then?
Yeah, that's what I was just going to say. Most of the employees choose this plan because the employer obviously contributes the most amount of money towards it.
Okay.
All right.
All right. Then you have your PPO plan.
Yeah, and this one literally has like 4 people on it. I highly doubt anybody is going to pick this plan just because the employer actually decreased the contribution towards it. So, you know, obviously they didn't pick, or they didn't have the participation before. I doubt they're going to get more this year, with that being said. But, I mean, it works just like a typical PPO plan. I mean, and there were some changes, modifications to the plan. Again, they were very slight, like the CHMO plan, so nothing substantial.
And as usual, all these plans, if you're out of a network, your costs will be more.
Yes. Yeah, because you have to deal with balanced billing as well. So.
Right. Okay, then they have. Was there anything else you wanted to share on medical, or should we move to dental?
No, I'm not going through how it works. I'm sure your people know how all those, like, I wouldn't explain to them how I'd explain in my meeting, because usually I go over, you know, deductible, co-insurance, you know, all that stuff. But most, I mean, everybody knows on the phone, right, what all that is, correct?
Yes, they do. Mm-hmm. If there's anybody that needs an explanation, let us know now so we can make the explanation now, but I'm sure you all know about the co-pays and the deductibles and the co-insurances and stuff that most of these plans have, and you have this benefit booklet that has it explained in depth, and I put a brief synopsis in our enrollment guide that I updated guide that I sent out. All right, so here is the dental plan. Yes.
Andrea, I have a question. Okay, on the HMO that has the fund, does it remain the same year over year, or is it that, like, for people that have been that were there last year and this year, does the fund have any changes if they were any unused portion or something like that, or it just remains the same?
That's a great question. It rolls over. So anything that they haven't used rolls over into the next year.
Okay, thank you.
Okay, so they could theoretically have more in their employee fund than the $500 and $1,000 if they didn't use it the year before.
Exactly.
Okay. Well, thank you, Veronica. That was a good question. So everybody understand that if they don't use the employee fund, monies that are still there roll over to the next year. So at least it's not use it or lose it.
Yeah, it's a great plan.
Yeah. All right. Then they have a dental and Aetna plan, PPO plan. What did you want to share about that one, Erica?
This one is very straightforward. It's your traditional Aetna PPO, or PPO plan, I should say, PPO dental plan. The annual max is $1,500. There's nothing really different about this plan, you know, against any other PPO plan. I haven't had a whole lot of issues, and not a lot of people really, I mean, come to me about the PPO dental, so I don't really think that you guys will have to feel too much of that.
And I did have one question. I noticed on the in your benefit booklet, the out of network had the same coinsurances as the in network, and usually they're less. So this plan, they're not penalized for going out of network?
Well, they are penalized, because what happens when you go out of network, even though it's the same percentages, you're subject to balance. So the thing is, like, we'll just use the basic services as an example. So if you have a filling, or I should say probably what a crown or something like that costs $1,000. Okay, you go to an in-network dentist. His contractual agreement with Aetna for that crown is $800. The patient's only going to pay the 20% of that $800, and then the provider has to write off the excess because they have a contractual obligation. But if they go out of network, the provider doesn't have to write that off, and that's what's called balance bills. So they would have to pay the difference from what the carrier reimburses for that specific service, and then what the provider is actually charging, because they're a non-contracted provider.
Oh, okay. So the costs are going to be higher.
Yes. Even though the percentage is the same, it's that because you go to an out-of-network provider, they don't have a contractual agreement with the insurance carrier. So the insurance carrier is only going to reimburse for that service what they would reimburse a contracted provider. But it doesn't mean that the out-of-network provider has to write off that excess amount if they're charging over that. They can bill the patient for it because there's no contractual agreement.
All right. So, like in your example with the crown, that was $1,000, and the contracted amount was $800. In the out-of-network, that $1,000, there's no contracted amount, so it's going to be a higher cost, and they'll have to pay that difference plus the 20%.
Exactly.
Okay, got it. All right, so that's the medical, and ortho is not covered, and it's you can see preventative is 100%, basic and is 80%, and major procedures are 50%, and no ortho.
And all right, then they have preventive care is, you know, basically your cleanings, your x-rays, and they get those for free twice a year. But keep in mind, out of network, you see it's covered 100%. Out of network, they're going to be subject to balance billing if, you know, the provider charges more than the carrier reimburses.
All right, so it behooves them to find a network carrier. I mean, a network provider.
Yeah.
All right, the vision plan, VSP. Now, is that also through Aetna, or is it just a straight VSP plan?
It's a straight VSP plan, standalone. And again, very straightforward. We don't really talk too much about the out-of-network benefits because 99.9% of optometrists and a lot of these, like Costco now, I believe is contract with VSP. So it's really difficult to go out of network with VSP. So I always just try to stay, you know, in network and reference to the VSP website for them to look up a provider. Same goes for the dental and the medical with Aetna. I always reference them to go to the website to look up providers to make sure, you know, that they know that they're going to a contracted provider, or if they're picking an HMO, yada, yada, yada. So this one, the examination is a $10 copay. You pay a materials copay of $25. You get the benefit frequency is that you get an examination, lenses, or frames every year. So it's a really nice benefit frequency. Once you pay that $25, go ahead.
Yes, it is, because most plans, the frames are every 24 months, so it's nice to have frames every 12 months. Exactly.
It's usually like a 12-24-24 or 12-12-24. So to have it every year is pretty good for lenses and frames. Once you pay the $25 material copay and network, all the lenses are covered at 100%. As you can see in the out-of-network, you can see that there's a certain dollar amount that's covered towards whatever they charge, so it's not in the member's best interest to go out of network. Contact lenses, if elective, they'll give them a $130 allowance. And then I believe frames is $130 allowance. Yep. You can see on the left-hand side of the flyer, we put on each of those pages the website where they can locate providers.
Okay, and then we move on to basic life, and that's my husband's phone ringing.
Good.
He didn't take them. Sorry, people.
Okay. That one is really obviously very straightforward. Just a $25,000 basic life and AD&D policy paid by the employer. So, I mean, that's pretty much it. The employer tracks the beneficiary. So on the universal enrollment form that I sent over, there's an area where they can assign a beneficiary. So we've got that covered. You guys don't really need to probably do anything with that. So.
Yeah, well, I'll show the form as soon as we're done with the book so they can see what the form looks like, and I can point anything out. All right, and then voluntary is through principal, like you said, and this is not the first year with it, correct?
No, so this is not going to be an open enrollment for principal, so keep that in mind. So employees call up and they want to, they've already been, they were already eligible, they waived previously, or they want to increase any of their amounts. They cannot do that at this time unless they fill out an EOI. So the medical questionnaire, which they will have. So basically, it's more just, we just include this, and principal is going to be there to field any questions if any existing employees have the Vol Life coverage and, they want to know something. It's probably not going to spend very much time on this. But just know that it's not an open enrollment for the Vol Life.
Okay, and so anybody who does want to do anything and they receive the EOIs in their packets, and if they want to do anything?
Yes.
Okay. And then here you can see, like she mentioned, cost-wise, you can see that the HRA HMO is the least expensive option of their options, which is why most employees, I'm sure, are on it.
Yeah.
Plus, it seems like a nice plan.
Yeah.
All right, and so.
And really important, if you go down to the next page where the contacts are, I want to point this out to everybody because this will, if for some reason, wait, I think, maybe go all the way. This is all the disclosures. I think it's in the very back, actually.
Oh, okay, see, these are, so you got all the disclosures that are in
here. You guys don't need to do anything with this. This is just, all the stuff we have to put in there to mean, so that the employer's in compliance. So if you can go all the way to the very, mostly to the end of the brochure, it's probably on the second to last page.
Okay.
There's a contact sheet that has Aetna's contact, VSP's contact information, principal's contact information, and it has our contact information. So that's maybe something. Yeah, mine hasn't come up yet. Flagging a little bit. But it's something called our Orion Helpline, and we advertise. Mine's frozen, so it's not.
Oh, yours not. Yeah, I have the page pulled up, so it does say Orion Helpline. So if you want to explain that.
Yeah, basically that. Okay, here we go. It's moving now. Basically, that helpline is something that we definitely advertise to the employees at all open enrollments, and we will have plastic credit cards to distribute out to them for their wallet. So they can call into that number if they have any questions about their plans, or they go home and their wife has questions. So even if you guys get stuck on something, there it is, and you're like, you know what, I'm not really sure, I don't feel right answering this, anything, don't, feel free to transfer them, or not transfer them, but to advise them to call that line, and we will be happy to help them. Or if there's just something that, maybe they want a particular form that obviously you don't have because you only have the universal enrollment form, you can send them over to that line, and we can take care of them. There's also an email address for them as well, or for us as well, that they can call or they can email. So we have plenty of backup.
It sounds like you do. You have a nice setup here. So let's see. We'll look real quick at the universal election form. There we go. And every employee needs to fill out one of these forms, I'm assuming?
Yes. I did confirm with Elizabeth at the group that every employee needs to complete one of these forms.
And so they can just, if anybody has any questions on this form, what can the benefit counselors tell them? Can they instruct them that go to Elizabeth, go to you, or if there's anything on here?
They can definitely call either our helpline or go to Elizabeth. I mean, I would probably recommend them going to our helpline first, because I don't want to bombard Elizabeth with that kind of stuff. I want to help her as much as possible because my team knows what they need to, they're very familiar with that form. So,
Andrea, were you intending to show that on the screen? Because right now we can't see that.
Oh, I have it up.
Do you really? Okay. Yeah, it's probably on my side then.
And I am sharing the screen. Can anybody see the form?
No.
Okay.
No.
It's a very basic form. It's a 2-page form that just simply, has the employee's information they need to complete at the top part of it. And then down below, it's just a bunch of boxes of each of the plans that we went over and how they're going to enroll, and next to, as far as dependents, and next to it what the payroll deduction is. So it just goes over what we basically went over in this guide, but puts it into an enrollment form so that people can make their elections, and then they sign and date the bottom. It's very straightforward.
And then there is a
the only thing I
think box.
What?
I was going to say, and it looks like that they also have to check if they're declining an initial, if they are declining any of the benefits as well.
Yeah, there is underneath. There is a decline box, and then also, that's probably pretty important is the up at the top, right next to where the employee completes their information, the employer has a box there. It says employer use only. There's a location box there. So if you are working with anybody, just make sure that they know what location they're from. I mean, we could find them. It's not going to be something we couldn't find, but if you think of it, just try to always make sure that they complete the location, because obviously they have multiple locations.
Andrea?
Yes.
Where do they turn in the paperwork?
We want them, another good question. We want them to turn them in. I think Elizabeth wants to shoot for, and I don't know if you should quote me on this, but I think that she wants them turned in, what we're going to do is, as we do meetings, obviously, the further out we get, those people are going to get more time. So the Ontario people, I know that we're going to the 3rd and the 4th. I think she wants them turned in by the 14th of March.
Who do they turn them into?
Oh, they would turn those into Elizabeth Pinedo, which is the HR director.
And how about if they're up north, like where Wendy is?
We'll be.
Is Elizabeth
we're going to be up there too. Yeah, we're going to be up north. Elizabeth and I are going to be up north too. She's going to be at all the meetings with me. So what she generally does, or what we've done last year, is that the manager of that particular facility collects all of the forms and then sends it to her via email.
So if they're enrolling on the call center, we can just have them turn it into the manager at the location?
Yeah, that would be fine.
Perfect.
Great question.
Okay, thank you. That is a good question, because we do need to know where to send them with the form.
Yeah, she's one of our better ones.
And then, and the nice thing on this form is they highlighted it and they put little arrows on wherever the employee needs to sign. And here in this they have a it's yellow where they need to sign, and a little red arrow for the beneficiary section, and then down at the bottom where they need to sign, and then after the arbitration agreement. So there's 3 places where they need to sign. And so what Erica has nicely made this form very user-friendly for these employees.
Stuck on something as well and you want to call in, you can go ahead and call in that helpline, yourself. If whatever you want to do, I just want you to know that that's available, and my team is always handling it 8:30 to 5 every day.
Great. So if you receive any questions that you don't know the answer to, you can quickly call that helpline then and get an answer, and then tell the employee. Well, or you can call the line together, I guess, if the employee's sitting with you and has a question.
Yeah, exactly.
I have another question. If the person loses their form and they're calling in on the call center, is there going to be a location on site where they could get another copy of the form?
Yes. Yes, so we ship materials out to each location. So all those, and there's an overabundance of them. So if for some reason they do lose their universal enrollment form, they can go to their manager at the branch and they can request a new one.
Thank you.
Mm-hmm.
And one more question. Are they going to get cards for the dental in the vision?
No. The vision doesn't, BST doesn't distribute cards, personalized cards for employees. They have like these generic cards, but mostly what we'll talk about at the meetings is whenever they go in, contracted provider or any provider that is using BST, they're going to reference their group number, which is HCI's group number, and they're also going to reference their Social Security number. And with those 2 pieces of information, the provider should be able to verify the eligibility. As far as the dental is concerned, there won't be a reissuing of any dental cards that I know of. So, if they need a dental card, they don't have it they just need to let us know and we'll get one ordered for them.
Okay,
all the cards are the same.
If they're enrolling spouses and dependents, are they going to be needing the Social Security number?
Yeah, on the medical, yes, because of CMS guidelines, they will have to now have the Social Security numbers. A lot of times, I know Aetna's been a little lenient with getting that information. They gave them a little bit more time, so they've let the dependents enroll without this. But yes, they will need to get the Social Security number for everybody. Children, they're very lenient on, but spouses, no.
And you can see on their universal form that section 3 is where they need to fill out the information on themselves and their spouse, their children. The section with the primary care physician number, if they're an existing patient, can they just write there, keep the same? Or do they have to look up and find their primary care physician number?
They can put keep the same. They can put keep the same because a lot of these people are already enrolled. It's not like we're moving into a new carrier or core benefits. Like most of these people that are enrolling are already enrolled. So yeah, they don't need to go and look up the provider all over again. They can just put keep as is or keep the same, whatever.
Perfect. That saves time, I know. So if they're making no changes, do they still need to fill out this form and check what they're keeping? Okay, so every employee, no matter
the most important part of this form is that they're authorizing the payroll deduction.
Oh,
I have
okay.
a question. If they needed to have a card of some sort, an ID card, can they use the helpline to get that?
Yes. Yeah. So if they need an ID card, things like that, guys, you can just refer them to the helpline. I would just say, oh, I'm mostly here to help with any benefit-related questions, as far as, the benefit. But if you need like an ID card, and this will be something that we will talk about at the meeting, so hopefully you won't get, I don't think you're going to get very many people who are going to call up and say, can I get an ID card from you? You know what I mean? Like, or they're going to say, I think that they'll understand, especially because we're going to be passing out those credit cards. They're supposed to be delivered tomorrow, but it's that plastic card that looks just like the one that's on the screen right now, front and back, that they're going to be able to put in their wallet. So we're going to be like, I would say that other than to contact the call center just for if they're interested in the voluntary benefits is what you're going to get. I don't think you're going to get like a whole lot of service stuff. Well, hopefully you won't get a whole.
We'll cross our fingers.
Well, I didn't do my job effectively if you're getting that, because I like I said, I really advertised this Orion helpline, so I don't think that they should be calling you guys for that. Yeah.
Well, it's a nice feature that you have, so hopefully the employees are appreciative of it. Okay, so those are the forms and those are the core plans. Does anybody have any questions before we let everybody go, get their dinner?
I'd like to thank Erica for being so energetic and specific about everything, because we do this a lot with brokers, and Erica, you did a great job. Thank you very much.
Oh, thank you, Mike.
Yes, we really appreciate when the brokers get on this call with us, so that my benefit counselors have the opportunity to ask those questions, those really great questions that they have.
Yeah, they had some really good ones. No, I'm happy to do it because at least we're all on the same page. And, if we miss something along the way, I think we have enough resources from what we now just discussed that we'll be fine. So we can just back each other up.
Yes. Okay. If there are no other questions, Mike, did you want to say anything else? I think that's it on this meeting call.
No, as usual, you handled it. You took care of everything specifically that needed to be addressed, and this is not a difficult enrollment. Colonial only. It's almost like we can do it, with our eyes shut. So, Erica, I'm not going to be. I have to be in Orange County, and this is an appointment that's been scheduled for 6 weeks. I have to be in Orange County at 10:30, so I'm not going to be down there on Thursday. I mentioned that to Elizabeth when I was on the phone with her last week. But you are in great hands. I don't need to be there for anything. All I do is take up some of the oxygen in the room. So, but I'll be checking up.
Amen to that, brother. The oxygen.
Yes, Rodney and Elton will be there, the two benefits counselors that you requested to have in Ontario, so you'll be well covered.
You want to send Andrea do you mind sending me the list of who's attending what location?
Yeah, I can. The benefits get all
Okay.
Okay. I hear some background noise from somewhere, but so I guess if nobody else has any questions, we'll end this training call. So thank you, everybody. Appreciate you being able to help on this account.
Thank you.
Thank you.
Thank you.